just to speak about the Mpox response and the collaboration that we've had, the support that we've had from Red Cross. Apparently Red Cross has been very helpful for us as a district. They've helped us mount up the necessary response with support in terms of community engagement. So Red Cross, the only partner that we've had with regard to the Mpox response, has been very instrumental in helping the district get to the community level, mobilizing that needed community response and educating the masses in the district with regard to disease prevention and how to reduce transmission. Even the identification of signs and symptoms and early presentation to the facilities for those who manifest the signs and symptoms, which we have seen. And even in terms of when we have had cases, the Red Cross has supported us with regard to mobility, visiting those who are affected, giving them the much needed health education and surveillance in terms of maybe if it's a household, who else has, or in the neighborhood, who else has.
Okay, so today we're here at Quasi Urban Health Center, one of the facilities that was identified as a high-risk area, where we selected some volunteers to train them on the Mpox project. So today I'm joined by one of the volunteers who was trained by the Zambia Red Cross Society and in conjunction with the Ministry of Health to go and conduct community-based sensitizations. Could you please tell us more about our national
Ineneba magitile yeshi nabandishiba mu community. Ifo cyari mukwayi iyo twafumile ku training ya Mpox twadishile ingira mukatikamushi. Iyo twayingira mukatikamushi twale ipushanya twale lanshanya nabela beni abantu. Bashire tupshamo bwino bulwele bwafuma kwi twaliambire okubalondo lwela. Ubulwele mwe bantu bakwalesa nabuyisa muno mumwesu mundola. Ikwena ubulwele ngetubatsambishe ba Red Cross. Ubulwele bulechita okutuwa mfako omutwe, wamfako omusana, amako okupwa, impepo, fyafino twafulo twabanga fidya nefipumba, fyalefuma, ndimo twafuma kwati tunono. Ero twishile tulekula. But aba symptoms akula moneka nga tuwapa kliniki. Akula tundapa.
It was not so pronounced at first because we only had a case that was just sounding to say no, it was in Central Province. Until when we had cases right here on the Copper Belt in Kitwe, then we had suspected cases here in Ndola. So that I think also tried to bring out the issues of trying to respond with the community. We are glad that Red Cross has also brought us IEC materials. This will also be a very good thing to get to the community to talk to them about Mpox.
We are talking about the Mpox, which is the monkeypox, a viral disease which has hit epidemic proportions in our neighbor, the Congo, and we've had a number of outbreaks within the country in several districts around Zambia. And Kitwe is one of the districts that have recorded Mpox cases. So far, we have had 6 cases. And among the 6, we have seen children, 2 children and 4 adults that suffered the Mpox. And a lot of work should be done to ensure that, number 1, we treat those that are infected, and number 2, we prevent spread to the next person. And these are the areas of focus that we're working with our partners, the Red Cross Society, which has been our major partner on the Mpox outbreak.
Lero bali kwete okutupera omulimo wa kuyingira door to door awo abantu bakubala bale kwata okutwishika ngo obulwele kanshi bwafumina kuyisa. So efe twashire kwata okubalondolo era ati awo obulwele bulepaya emukwayi. So bakwete okukipokerera kabiri ne kulingana na bu volunteer paka wa makliniki. Uyu mulimo wa bu volunteer wa kupita kirangande okusambirisha ba community. Bantu ba community omo twikala so bali kipokerera. Bena bale fwa fyo obuchingo filafine ya ishire ya kolera vaccine. nabena mukwayi babena bale kwata okulolera ati mukaleeteko neyi mpox bantu bubulwere bwabipisha.
There was 6 months project where a lot has been done to ensure that our people get to know about the disease and how do we get this information to our people. The strategy was through the media, supported radio programs have been held, but most importantly, Red Cross went ahead to train our community members, give them information and support their going door to door in the high-risk areas. We have seen a lot of transmission through close contact. It could be sexual or even sleeping in a bed, sharing beddings may spread the condition. I want to also thank the Red Cross. Their focus was on the community, but we went to them, reached out to them. We said, look, our frontline staff also may not know much about the Mpox, and they also helped to ensure that every facility within Kitwe district has somebody trained, and in turn they also do on-job training of other facilities. So on the front, we are well equipped with ability to make an early diagnosis, give our communities information, and so far we have seen a high increase in the number of suspected cases, and among these suspected cases, that's how we get to make a diagnosis of the 6 that we talked about earlier.
Ubulwere umuletira chi monkeypox nga chakutira bwaleta omwapya na mwenso kulifunga fafya so chikankala ndetotera sana kuli mumweshi pakutira na fo bene nombapa bingire kwate ko kampulo ko badina fo to afunda ko tokwata na menzo ya epile balelanda ati monkeypox twalaisha kumunga twamona fafine twabatwana ngpa clinic na.
The province doesn't have diagnostic capacity. We've appealed to our partners to prioritize ability for us to diagnose within the province or in our districts, so that we quicken the process of surveillance, the process of getting to know whether it's Mpox or not, because it's inconvenient for our clients. Also, once we suspect, we treat it as if it were positive. So when it comes out as negative, a lot of resources are spent, a lot of time has been spent. It would be nice that we are able to make the diagnosis within our realms. Through Red Cross and the Ministry of Health, we have been distributing brochures. We have been having contact with various organizations to talk about it.
A few months ago, we had a workshop under Zambian Red Cross Society that was passing on information about the Mpox disease. And from what I have learned, this knowledge has really helped us a lot, because you might find that before we really had knowledge about this disease, we had certain things that we used to do that we didn't really know might cause this disease. But after learning to say this disease might be transmitted through contact, skin to skin and all that, we learned to adapt a new life. And after that, we have managed to even go around the community and teach people about this disease.
Twamona kwati twalife muturo ero twasarapuka nokutulanga ovo twalambo kwikala nokuisunga so cho tulero mbo kutotera otwatotera pakutuchingirira pakutwishibisha ko twambe kuichingirira kefire ishiro umuntu mwingi sana nokwa kukana chinjana nefi yakufwala nango wamfo muntu uli analwala takuli kupalamina nango kuchinjani cha kufwala nango
twatotera sana pakutu tumina ko abakututandalirako kweba basamukutufundako kubulwere bwa Mpox. Ubulwere na atufunda kweba buleipaya era futa buleisa bwino nga kubana kashi na kubaume kweba ati ubulwere bwafumine kuchinama chikolwe so twetotera kuli ba Red Cross.
We also go in schools. For example, right now we are visiting a school which is called Chikola Secondary School, where we had to go and teach the pupils at this school about the disease. I hug this person. It's either I transmit the disease to him or he transmits the disease to me. And away from that, let's also talk about sharing of clothing.
We have received the Red Cross organization. It's a very good organization. It has really educated us on a lot of things, especially on the healthy sector. So as the students of Chikola Secondary School, we've learned what the Red Cross members have brought to us. We've learned about the Mpox, how it is spread, the prevention and the symptoms of the Mpox.
I would like to just say thank you for the team for passing through our school and giving our learners a talk about Mpox. We are truly grateful for the visit. I think the location of the school makes us a bit vulnerable to this disease. So we're grateful that the team came through.
Thank you, Zambia Red Cross!
Chilabombo, it being a border area, the Kasumbalesa, it is at high risk of Mpox. The Ministry of Health have partnered with Red Cross, who has really helped us intensifying the sensitization of our communities to be aware of this deadly disease, which is Mpox.
We are here in Chilabombo, Kasumbalesa border. We are just near with the Kasumbalesa from DRC, and we are doing the sensitization concerning Mpox.
Abafuere ifine fya musalaba wakashika baretwa tin ba Red Cross ro barekta mukwambo kutweba kona bene ko ari ekwa face to kwati tunge mfoko ati natatu pokerera no bubulwele bwa Mpox bale trondola ko kweba tubulwele obubinganje
ine pano kwena nde irishana ni kwato buranda pari ubwino obulwele bwa Mpox kabiri natukwata abaneswa abena Kongo nshirana shifura sana bantu nangu barefika kuno ubulwele bareka mkushitefya ifi ba Red Cross baisa kuno kwena kwatemwa kabitwatotera pakuti benga tukanshako benga tusambirishako parifi.
So Red Cross have had several trainings of our community-based volunteers who are our eyes as a district health. These volunteers are well trained and they have been placed in point of entries. Chinsenda, we have got the Red Cross trained CBVs who are monitoring, also Kasumbalesa border, they are there, Chimfunshi, they are there. They are sensitizing the community, doing door-to-door sensitization.
We are in Konkora Stadium to utilize this opportunity because Konkora Braves is playing against Kafue Eagles. So we are here to sensitize people about Mpox virus.
As of now, we haven't recorded an Mpox case. This is due to the sensitization which Red Cross has done with the CBVs as well as the communities.
Ninte mwefu ba Red Cross beshire mu kunsambisha kairinga nshishi beri mbiti na sangwa mu masanzo ya ubwino burwere kari ngana sangwa teti njishibati uburwere limbi kutinjikere feno yana ku clinic nomba pefi beshire mu kunsambisha ko ninte mwefu.
As Ministry of Health, we are really grateful for what Red Cross has been doing because us alone we can't manage, but they've come in to help us. As a district, we've recorded some successes. One of them is that we haven't yet recorded any Mpox case. The other thing which we've succeeded as a district through Red Cross is the training of the CBVs, because Kasumbalesa is a very densely populated area. We have got the influx of people coming from Congo on a daily basis, not only from Congo but from all parts of Zambia. So we would really love to have more trainings in terms of CBVs so that we can have enough CBVs who will be monitoring the disease as well as sensitizing the community.
Stop the spread of Mpox!
17 suspected cases running from January this year, and out of the 17, only 3 have been proved positive cases. And the first case that we had in January was from Ngambi, which involved a truck driver, and this truck driver was traced to have come through across the border from the DRC. So we've engaged as an office alongside Zambia Red Cross Society, who has been very supportive in the sensitization through the CBVs that have been engaged through the society. We have our own CBVs, and the Red Cross has also brought in their CBVs who are out there in the community carrying out sensitization activities, okay, which are very helpful because this Mpox is coming from the community and it goes into the community. So the community engagement is proving to be very helpful. Okay, it's a bit difficult to really manage the cases on our own because there's another country involved. So of course we've engaged our cross-border counterparts in sensitizations through the cross-border interactions that we are having with the Congo DR at Mokambo border post. The outbreak is being controlled well. We are appreciative to the sponsors that have come on board through the Red Cross. So we are hopeful that eventually this will come to an end of.
So we're here at the Mokambo border, which is one of a site that was identified as a high-risk site for the Mpox disease. So there's a health facility here, which is Mokambo under Mufulira district, where we have volunteers and CBVs who we trained to take prevention messages out in the community and also to sensitize the community on the dangers or the risks that are there here at the border, because this border, the Mokambo border post, is dividing or is separating Zambia and the DRC, where we have many cases of Mpox that are coming from there. Already here in Mokambo, the facility has managed to record 4 confirmed cases of Mpox that have been identified by the CBVs, and they've been reported at the health facility. And the samples were collected and tested by the Zambia National Public Health Institute, and they came out positive. So as you can see, this is a very busy border.
Ila ba Red Cross Society baishire baitusambirisha efya kulanda n'abantu kabiri baitwebere nefumamo muntu ngakwata Mpox. Bali tupere nef picture ifya kulanga abantu ifyo bengeshi ba Mpox ifyo iremone. Dio twalesambirisha abantu bambi bayichipokerere bambi balekana balelanda ati iyo ifimule monefi uyu mwana kale fya mutampa bali mulowafi. Nomba afuta okubasambirisha balisailuka kwe bachachi ni obulwere obwishire kupanshita imo. Kabiri kwali n'abana babiri bo twasangireko twali basendere twabaleta na kliniki basenda na sample bapima 2 days basatu bwesha basatu bati ni Mpox bakwita bali abatekana kuchibolya mpaka nokupola abana bali abaponda.
So right now we are at Chiboja Clinic in Mufulira, and Chiboja Clinic is the isolation clinic for all the diseases in Chiboja. We went to this certain home in Chiboja as we were sensitizing for Mpox. We had found this boy. He was just at home. When we approached the same house, we saw that the boy had some signs and symptoms of Mpox. As we knocked, the grandmother to this boy came outside, and we explained to her to say we are suspecting to say your child has Mpox. So she responded that no, as the household we experienced this kind of rashes, so this could not be Mpox. So we tried to sensitize the way the Mpox signs and symptoms looks like. So when she saw the photos of the same Mpox disease, she agreed with me because they were looking alike with the signs the boy were having. So the grandma agreed, and we came to Chiboja Clinic, and the boy were being put in isolation center so that he can be observed. With that, the boy were found to truly have Mpox, and it was counted as one of the active cases of Mpox. So the boy has been discharged, and right now he's well, and he has gone back home.
Apo baredi kustabalisa mkwai tapari ko twaishi bena mpimukari mukuru nomba after baredi cross sana tusambirishwe pingi na pari chituletasha kuri baredi cross kutsira ati batwadirire ukuchita support ama families yesu kupitira mukutusambirisha mkwai.
When Mpox was recorded in Kalumbia district, Zambia Red Cross Society came in to train us as volunteers on how we should sensitize the people in the community on how to prevent and protect themselves from Mpox.
Before the volunteers of Red Cross came in to tell us about the same disease, we never knew anything. We used to greet carelessly anyone you meet. We never used to use preventive measures. Most of us as residents, we don't put on much interest on how to keep ourselves clean, especially with kids, and on how to use sanitizers and on how clean the food is. So we thank you so much for this effort that you use to come and help us. Thank you.
Communication channels that we use are face-to-face, that is door-to-door.
Zambia Red Cross
taught us about Mpox. Then afterward, they told us to say, since we are being taught, we're supposed to teach or tell people in the communities about Mpox so that they should know about it. The sensitization is really going on very well and the people are really happy.
Nashukuru sana kwa njina na nashukuru sana kwa hivi tena bakwako banatutembelea kwa leo na kutuonesha kwa hii magonjwa ya Mpox. Mungu awabariki. Tunashukuru kwa vile tunajua na shie. Mungu awabariki sana.
We also went at schools to sensitize the pupils. We also did a market sensitization. We also had a meeting with the community leaders.
We are so happy as the market committee. We have seen the Red Cross to come here to let us know how it is affecting our environment and affecting our people here at Maheva market.
We also did megaphone sensitization. It's to the people in the community. Those are the many and major ways that we use, major communication ways that we use to communicate with people in the community and sensitize to them on Mpox.